Dear students, we will discuss a topic on table finding actually, even though it's a clinical case study. See that breast lump is getting operated. So, what is this typical bosselated large mass, well localized, unlike carcinoma breast? What is this? What are the differential diagnoses? So, it is Phyllodes tumor, cystosarcoma phyllodes. It's a misnomer. It is not sarcoma. It's although called a serocystic disease of the Brody because a typical cystic and neoplastic condition both is well capsulated and it doesn't get attached to the skin, so it can probe the skin actually. Over the summit necrosis can occur, but you don't get adherent to each other, unlike carcinoma breast. So it looks like a localized one, but it can be malignant sometimes, borderline malignant, benign, like that. Classifications are there depending on the cellular nature. It is being graded. Different classifications are there. You can always go through my book in detail because it's a short note, and short case may become not as common as a carcinoma breast. If it is there during the time of exam, it can be kept as a short case or long case. And in the long case, this can be discussed as a differential diagnosis. So you have to keep in mind because it doesn't spread to the lymph node. It is localized disease commonly, occasionally turn into malignancy, and in such a situation, it may spread to the blood and becomes aggressive also, and become metastatic also. So there is a very aggressive nature also there, but commonly it is a rather benign entity. In between, sometimes intermediate category people also present with recurrence also known to occur. Remember, recurrent cystosarcoma phyllodes tumor is not unknown. Phyllodes is like a leaving branch, like leaves. Phyllodes word meaning is in the leaves, tree leaves like. So it looks like that. That's why it is named like that, Phyllodes tumor. And so mostly benign, can be locally aggressive, occasionally malignant or metastatic. Most common, it's a remember why MCQ question, non-epithelial connective tissue tumor of the breast. This word non-epithelial is very, very important. All those carcinoma breasts are different types are epithelial tumors. It is a non-epithelial tumor. That's the MCQ question. So you should remember that. Can be fibroepithelial, but never epithelial. So features are occurs in the middle age, elderly, grows rapidly, attains very large size, massive size attains. Even though skin is normal, mobile, won't get adherent that easily. Spread to lymph node and blood is not that common. But dilated veins are quite common when you look at that. This is warm because of the high vascularity, but not fixed to the skin and chest wall. Fixity is not common. So there is the different parts. Very look itself is very obvious. And here differential diagnosis is giant fibroadenoma of the breast. So it is says that initially olden days they used to call as a variant of the giant fibroadenoma of the breast also. One of the etiological factors is said to be like that, even though it is a non-epithelial tumor. So differential diagnosis, at least you have to remember as a giant fibroadenoma. You know that the meaning of the giant fibroadenoma is more than 5 centimeter. So there is also a different diagnosis you have to keep in mind. Investigations, ultrasound, mammography is important. Core biopsy always, true cut biopsy is important. Any breast lump, core biopsy is a standard investigation, not FNEs. Axillary lymph node, FN is the standard investigation, remember. So wide excision with 1 centimeter margin or recurrence of very large one, then total mastectomy is the treatment. And remember, send it for histology. Regular yearly or once in 6 months, regular follow-up clinically and sonologically is very, very important. And if wide excision is not feasible or possible, then you should go ahead and do the total mastectomy. Again, lymph node involvement is not common. That's why lymph node dissection is not necessary in case of Phyllodes tumor. But chest wall, in aggressive tumor, chest wall involvement can occur, metastatic disease can occur. Remember, keep it in mind. So proper follow-up is very, very essential in this patient, even though it is very much benign or less aggressive. Certain percentage of patient can be malignant and very, very aggressive. That point you have to keep in mind. But behavior is totally different from what is you see in carcinoma breast, which is more common. So answer the MCQ. A lactating lady developed a lump in the breast after stopping breastfeeding. What is the likely cause? A. Fat necrosis. B. Phyllodes tumor. C. galactosyl. D. Fibroadenoma breast. Students, please put the right answer in the comment box. I will give the answer later. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic, and principles of examination is good, and differential diagnosis in the table format is given, and briefly investigation. Suppose treatment is not a topic will be covered in a clinical method examination, remember, and many photos of the most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn very basic required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB manual of surgery is very popular. It covers theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations and used worldwide also, actually including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB Operative Surgery Atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything with total around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by-step technical aspect. Very useful for postgraduates. But not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book. I will memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step-by-step with illustrations. And my SRB's Atlas of Tissue Approach, small book, Atlas, 100 pages, how to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. Your daily lectures are there, live sessions are there. My digital lecture through JP Publishers, around 220-hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.